Good afternoon, everyone, and thank you for staying with us so late in the day, and we appreciate your audience here today. So what I'd like to do is talk to you about the Ontario Food and Nutrition Strategy, and first and foremost to tell you that it is a collaborative effort. I am one of the co-chairs representing Dietitians of Canada, and I sit on the Ontario Collaborative Group for Healthy Eating and Physical Activity. And our other co-leader on this project is Ravenna Noemi Barker, who's at this conference, and she's from Sustain Ontario. And on our design team, who I've given credit for this slide presentation, there are over 20 member organizations, and I'll show you that slide at the end. It would take up my whole presentation showing you everyone that's been involved in this project. So moving ahead, I just want to give you sort of highlights of what is the Ontario Food and Nutrition Strategy and talk about some of the elements of it as we are still working on it. As Pat mentioned, it is a draft at this point, and we have been sharing it out amongst our stakeholders and also out to the ministries. We've had some meetings with the political staff at some of the key ministries, ministries of Education, Ministry of Agriculture, Food and Rural Affairs, Ministry of Child and Youth Services, and we're still setting up meetings with the Ministry of Health and Long-Term Care in Ontario. So we have been out several times to meet with the staff, but we're actually now going to the political players, and it's been a very interesting process. So the strategy is, as I have it on the slide here right now, a cross-government, multi-stakeholder coordinated approach to food policy development. And it's a plan for healthy food and farming in Ontario. And this was really the coming together of health, agriculture, food, education, multiple players to pull together this strategy. So the mission of the design team is to establish and implement this cross-sectoral Ontario Food and Nutrition Strategy to promote and support healthy Ontarians and a sustainable food system. And our vision is a productive, equitable, and sustainable food system that supports the health and well-being of all Ontarians. And we had come from about 10 goals down to 5 goals, and we've actually narrowed our goals down to 3 important, very important goals, and you'll see all of the important words highlighted in green. So our first goal is around health and healthy eating. So we're promoting health through healthy eating and access to healthful food for all Ontarians. So that access piece is critical. The food choices that people make is critical. Another goal is to reduce the burden of chronic disease and obesity on Ontarians and the Ontario healthcare system. And if you heard Nick Saul's presentation just earlier, he talked about 50% of the healthcare budget in Ontario being used towards health. And in terms of health, it's going towards treatment, not health promotion and health prevention. So less than 0.5%, I believe, is really going to health promotion right now in Ontario. So we're looking at changing some of those numbers. And our third goal is to strengthen the Ontario economy and environment through a diverse, healthy, and resilient food system. And if you went to the Edmonton Food Strategy presentation, you'll see a lot of similar words. We're looking at diverse, healthy, and resilient food systems. Resilience coming up a lot. Sustainable, we feel, is a word that's been used quite often, and people have different definitions of it. So we've actually expanded on our interpretation of sustainable, and we haven't used it at this point. And that was a lot of debate. So what we've done, so we actually started this process in 2009 with a background document where we looked at the functional capacities for doing a food and nutrition strategy in Ontario. We looked at a number of things, including leadership, goal setting, and this is at the ministry level, goal and objective setting. We looked at research supports. There was a list of 11 things that we took based on the Chronic Disease Prevention Alliance of Canada's method to assess functional capacity. So we did a report. It is available on the Sustain Ontario website if anyone's looking to find out more about that. It's called our background document number 1. And our second report, falling out of that, was a list of about 10 recommendations. And as you can imagine, there was lots of things we felt that we could do. And we decided to have a consultation over those recommendations. So we've actually had 2 rounds of consultations in 2011. And the people that attended this, there was over 40 different groups represented, the health agencies, education groups, the ministry advisors, the 4 key ministries that I spoke of earlier were in attendance. We had food and farming groups and some not enough food security folks and poverty reduction folks at the table at our first few rounds, and at our latest meetings we've tried to incorporate those groups as well. So those 2 meetings happened in 2011, and the outcome of our very first meeting was the creation of our design team. And so the design team has been charged with coming up with what does the strategy look like, the goals, objectives, and all of the content. And we actually did an online consultation sponsored by Sustain Ontario, where we got quite a lot of feedback, and I'll have a slide on that. And then in 2012, we had some recommendations that we were being pushed to. You know, you have to deal with the priority issues on the table at the time with the government. And the two issues were the Local Food Act, which actually came through our government past first reading about a month ago, and then our Premier has resigned and prorogued government. So that, you know, it's sort of dead in the water right now, and we hope it will come back, because it did talk a lot about local food procurement for municipalities, universities, colleges, schools, and things like that, and other ways that we can promote local and sustainable foods in our province. And the other thing that's happening concurrently to our work is the Childhood Obesity Panel. And as we all know, childhood obesity in Canada is a big issue, and Ontario has struck a panel, including representatives from industry and from public health, and a broad-based representation of folks. And they're charged with coming up with some recommendations to reduce childhood obesity by 20%. And it's a very lofty goal, and I'm not sure that they're going to achieve that, but they are going to be coming up with some recommendations. So our group, as well as many others, were charged with making some recommendations to that group. What we've done, this is a very busy slide, and I don't want to talk about it too long because I don't have that much time, but it really just, again, we looked at the 4 key ministries, and I don't have a pointer, but the white ones that are bolded in the center are the Ministries of Health and Long-Term Care and all of the programs coming out of there, and the Ministry of Agriculture and Food, the Ministry of Education. In Ontario, we have School and Food and Nutrition Guidelines. We have a Northern Fruit and Vegetable Program. Those are just some examples. In Ontario, we also have Eat Right Ontario, which is a web-based resource that consumers can go to look for information, and we also have a telephone answering service where consumers can talk to dietitians to get advice. And one of the things that astounded us when we looked at this is there was very little research happening, particularly in the Ministry of Health and Long-Term Care, related to food security, poverty reduction, and healthy food strategies and things like that. So we really feel that we're doing a lot of work to aid and assist what we feel is not happening in as much capacity as we would hope for in that particular ministry. The Public Health Ontario is helping us with some of our data for indicators and things like that. So, I mean, there are key supports there as well. So we did this online consultation on our first draft of our strategy. We had over 233 participants and 126 submissions. We had lots of data to work with. We had consultations from all over our province, so that's a picture of some of the spots where our consultation groups were, and a lot of them were group presentations, groups of dietitians, food policy councils. We have about 13 in Ontario that responded. So a lot of this information was collaborative comments back to us. So based on that consultation, we came up with our revised strategy, and I've already talked about the mission and the goals and our vision. So this slide is too small to read, so I'll just keep flipping through and I'll talk about some of the specific elements. So the strategic directions are that Ontarians have access to and the means to obtain safe, healthy, local, and culturally acceptable foods, that Ontarians have the information, knowledge, skills, relationships, and environments to support healthy eating and make healthy choices where they live, work, learn, and play, And those are the buzzwords in Ontario, where people live, learn, work, and play. And so we're trying to align with some of the government initiatives at this point. And Ontario has that diverse and sustainable food production system that contributes to an equitable and prosperous economy. And we have a lot of words here that people might want to know how we've defined them, and so we actually do have a glossary for things like sustainable food production, equitable, and things like that, nutritious and healthy foods, for example, which we know Health Canada has struggled with coming up with definitions for. So for the purpose of our paper, we've actually defined a lot of these terms. And these are the 5 key supports or recommendations that we're going forward with while we are talking to the political powers in the province right now, the 4 key ministries, as I mentioned. So we're asking for a coordinated provincial mechanism and advisory council to address the complex food system that's cross-government and multi-stakeholder. So it's not just the government's responsibility to have a food strategy, it's to work with all the stakeholders. But what we're really stressing is that it become cross-government. We're also lacking consistently gathered data, so we're asking for ongoing monitoring, measurement, analysis, and dissemination of key health, social, economic, environmental, and food supply indicators. And that indicators work is a lot of work. We are now turning to some of our academic advisors to get more help with some of that indicators work, and Public Health Ontario is helping as well. We're looking at policy, legislation, regulation, programming, and we haven't come up with any policy ideas. I mean, we have policy ideas, lots of them, but we haven't made those policy recommendations at this point. But we feel that that's an important thing that needs to happen, and that we need capacity and resources to support all of the elements of this strategy. And one thing that's very important as well is clear, effective, timely communication at all levels among all players with respect to food system decision making. And we are taking our draft strategy out to our 40-plus stakeholder groups again. And we're also looking at some way to involve more citizen engagement. I know that was talked about a lot this morning, and I know Edmonton has done some great work on their participant panel, their community panel. So that's the kind of thing that we're looking at trying to incorporate with our next phase of our consultation. At our last meeting in June with our stakeholder groups, we had some dreaming. If, you know, by 2017, what would you like to see? And some of the things that came out were a long-term national and provincial food strategy, consistent messaging among all the groups, language moved beyond sustainability to regeneration, food lands are protected, Ontario foods are widely available through farm gate, farmers markets, community gardens, retail and institutional venues. Citizens know what healthy eating means and are eating well. And farm communities see their role in providing nutrition through food. So these are, I mean, there's more, you can read the rest here, but these are things that we are trying to move forward with our strategy. So what still needs to be done? We need to complete our action plan. I know Barbara Emmanuel was in the session this morning with Edmonton and was questioning whether an action plan is really important part, because you don't want to make it so rigid that you can't change it and that you can't be timely and work on whatever the priorities are. So I think we do have the nuts and bolts of an action plan in place, and it is a work in progress, and we are hoping to have that ready in the next couple of weeks to send that out for further consultation. It really gives people an idea of what can be done, what are the possibilities in Ontario for some of the strategies and actions. We need to identify some of the resources and enablers, and I said government can't do it all. They're relying on stakeholders to help move this along, and so those are some of our enablers and some of our resources. I spoke about the indicators. We definitely need research supports, and at the University of Guelph we have Ralph Martin, who is the new Loblaw, well, he's not new anymore, he's been there for a year, but he was appointed the Loblaw Chair in Sustainable Food. And so he's gathered a group of about 20 researchers, and we're now in the process of actually applying for grants to do some research on food security and feeding our population sustainable agriculture and things like that. So we're actually moving along quite well with the research contacts. At the provincial level, we don't have a champion. We don't even have a premier he's resigned. So we have talked to the premier's office. We've talked to the key ministries. We really do need that champion to help make this food and nutrition strategy go through. Right now, our champion is the Ministry of Agriculture and Food and Rural Affairs, because they see a huge role in this at this point. So they've been very supportive. We need infrastructure support. The players involved in this design team have been working off the side of their desks. And myself and Ravenna have been representing our organizations, but we do not have funding for our design team or any of the work that's been done to date other than through our organizations. So a number of other communication strategies need to be developed. We want to engage the youth and the public, as I said earlier. So I'm not going to show this slide. It's online, and it's just really showing what I've just talked about, and it's all of the key elements or key components of an Ontario food and nutrition strategy. But I really wanted to share with you the variety of groups that were involved in developing this food and nutrition strategy to date. So you can see we have the Canadian Cancer Society's Heart and Stroke. We've got farm groups, Dietitians of Canada, obviously, and a lot of universities have been involved through Ryerson, U of T, Waterloo, York. Various folks have come and gone from Wilfrid Laurier. And some government groups, funded groups as well, Public Health Ontario and the Nutrition Resource Centre. And some of the newer groups are the Organic Council of Ontario, the Christian Farmers Federation, and the Ecological Farmers of Ontario, Farm Start. And then we've got the Canadian Environmental Law Association, too, who you might not think is an obvious fit for this, but they've been very instrumental in helping us prepare some of our background materials, so they've been great to have as well. And so that's our team and our design team. And if you would like to see any of our resources, we will be posting this slide deck. It may be up there already, I'm not sure, but Sustain Ontario has been our host for our initiative, and so you can find all our papers at this website. It may be our old draft, and we are hoping to get the new draft up in the next couple of weeks, so check back then. Thank you very much.